I'm Carl Mercurio, and this is Healthcare Week in Review. When it comes to universal health care, all eyes are on Massachusetts. The state is now implementing its groundbreaking universal health care program, which mandates that everyone in the state purchase health insurance. Those too poor to pay receive state subsidies. Here to provide an update on the program is Leslie Kirwan, Secretary of Administration and Finance for the Commonwealth of Massachusetts. Leslie, thanks for joining us.
Sure thing.
Well, give us an update on where the plan is, how many people you've signed up, and how's it going?
Well, it's going really well. We've had a great year since the law was enacted only about a year ago. We have made a lot of tough decisions about implementation, created a whole administrative structure for delivering health care reform, provided a number of plans for folks receiving fully or partly subsidized insurance, and have just started offering unsubsidized health care through a number of our private insurers in the Commonwealth. When we started, we estimated that there were about 372,000 uninsured in Massachusetts, about 6% of the population of the state. And just in the last few months, we've signed up already 120,000 of those individuals and family members.
So you're off to a good start. Now, July 1st is the deadline for signing up, but the penalties don't kick until the end of the year. Is that correct?
That's right. What you're talking about is there's a really important part of health care reform that, as you said, requires that there's an individual mandate that every person who can afford it purchase insurance. Technically, that individual mandate kicks in July 1. The first year, the penalty involves a loss of personal exemption on the state tax payment, and that applies to anybody who doesn't have health insurance actually by the end of December. So there's a bit of a sign-up period from July 1 to December 31st, but we're already seeing people be very interested in enrolling.
Now, will this achieve the goal of universal health care? To some information, some skeptics have pointed out, hey, look, auto insurance is mandated, yet 15 to 20% of people don't have that. Will it achieve the goal?
It's going to come really close, and we'd rather focus on the fact that we're going to get at least 99% than focus on the fact that we may come a little bit short. The law requires us to provide quality and affordable health insurance to folks, and there's an understanding that not everybody right now is going to have access to affordable products, but through employer-sponsored insurance in many cases, and through the new products available through the Healthcare Connector, which is the new authority set up to implement healthcare reform, we're going to be able to cover about 99% of the population. We're not going to give up on the other 1% that right now we're not going to be subject to the mandate. We're going to work very hard to find ways to get them insured in later phases.
Now, the options are offered still by private health insurance plans, and you have 6 of them involved in the connector, as you said. What are the differentiators from a competitive standpoint when people look to pick a plan, and what is the relative profitability and margins that these plans can expect from this business?
What we did is to, for the unsubsidized products, provide specifications to insurers in the Commonwealth to tell us what they would like to provide so that we could offer a choice and a range of products to folks purchasing for the first time. Now, we needed to make sure that we had some sort of lowest tier products to make sure we had affordable products on the low end. But what we have on that end contains some pretty decent benefits, including low deductibles, pre-deductible care, 3 or 6 visits, depending on whether you're an individual or a family. We're requiring prescription drug coverage as part of our minimum product. We also have, if you sort of consider that the bronze product, there also are silver and gold, meaning you can sort of see the step up in the level of coverage that would be afforded for somewhat higher prices. And the plans all came in with products in all of those ranges. So each of the 6 plans is going to be giving us a gold and a silver and a bronze level product, in some cases more than one choice. That's really going to give folks a wide range of choice. We know that that kind of complicates their choice among them, so there are a lot of ways to help them make those choices, including talking to people over the phone in call centers and going online and being able to navigate those choices.
And the choice is made on price? Is that basically it?
Price and what's covered. For folks that can afford a higher premium, they can, in many cases, will be able to get first dollar coverage for the whole range of services. And for a bronze, in the more affordable range, you'll have higher deductibles and the like.
And what kind of margins are you talking about? Are these going to be profitable products for these companies?
Well, That remains to be seen. I think they wouldn't have bid them if they didn't expect they would be able to sustain that. But clearly, that's something that they're keeping to themselves, the carriers, that is, at this point. But we'll be very curious to see over time how much we can contain the increase in those costs, because clearly a big part of success in this is going to be keeping the products affordable over time.
Yeah, what is the outlook sort of for premiums if the plans aren't making money when they initially sign up, and then just the cost of the program in general? Is this sustainable?
Well, clearly, healthcare costs a lot of money, whether you're in a healthcare reform mode or not. And Massachusetts undertook this in part because it seemed like the path we were on was very expensive, and we're hoping that this will, over time, be more cost effective. Clearly, if we've all miscalculated and there are steep price increases on the premiums, that's going to be troubling from the standpoint of trying to ensure the success of healthcare reform. But there has been so much work and so much commitment on the part of all stakeholders to the Massachusetts plan, including the insurers, that we're hoping that commitment and some creativity will pay off. Of course, the most important element of this is doing a very robust outreach and enrollment process, because the one key to making sure that the products stay affordable is to make sure that we capture the younger and healthier folks who right now are choosing not to buy health insurance. Getting them into these products will help lower the cost for everyone, and that's really what we're focused on.
And then finally, is this Massachusetts program exportable to other states? Could this become, in effect, a national program?
There are certainly some unique features to Massachusetts that made it perhaps easier to tackle than it would be in other states. As I mentioned earlier, we have only about, we think, 6% of our population uninsured. Other states face much bigger percentages, and that would make it harder. We already had a very active participation with the federal government on reimbursing us for our Medicaid recipients, and that was one of the drivers of this program. We also had a really, really committed, very broad group of stakeholders on all sides of the issue that leaned in and made significant compromises, working together to ensure the success of this. You may not be able to replicate that in other states, but we're really cognizant that people are watching us, that all eyes are on Massachusetts, as you said, and we take that responsibility very seriously. So opportunities like this to educate people about what we're doing, we think it's a great investment, and we in turn would welcome learning from what other states are doing, because we know that our program is going to have to evolve. We don't have all the answers right now. We've put in a lot of tent stakes, and we're going to raise the tent, try to capture as many of the uninsured under that tent, but we may have to adjust that a little bit as we learn.
Great. Thank you very much. From the Standard & Poor's offices in New York, I'm Carl Mercurio.